Welcome back. You are still watching People and Power right here on NBS television. The hashtag across all our social media platforms are NBS People and Power. My name is Mebo Twegumiezake, and this episode belongs to Dr. John Ekure. He's an orthopedic surgeon and the director, Kumi Orthopaedic Center. We've traveled quite a journey and it's been worth it, Doctor. So thank you so much for receiving us.
You're welcome.
And we continue with sidelines. Continue with your thoughts on bone setters, Doctor. You say this is what Africans know. And these Africans believe that you can go to a bone setter, and I want your thoughts on it. You can go to a bone setter, he checks out your probably, if it's a broken bone or maybe it's a dislocation, and he tells you to go back at home and he will massage it from his home and also you probably in your bed or sitting room, and you will be okay. And there are stories and testimonies that this works. How do you, okay, as a scientist, explain how it works, because people say it works.
No, it doesn't work. First of all, for healing, for these bones to heal, all you need is correct position of the broken bones. And then the healing process starts immediately you break. The body begins to repair itself immediately you break. So long as they're in contact, they will heal. So when they tell you that they will be massaging at home, what it means is that they will want you to stay still, not shake it, because if you move, you will disrupt the healing process. But they are not aware of that. What they are aware of is that if you rest at home, the bone will heal in weeks. And I can tell you, if you broke your upper limbs, any bone in the upper limbs, it takes only 6 weeks for it to heal. If you break the bones in the lower limbs, it takes a minimum of 12 weeks for them to heal, on average. Now, this belief, like I said, is really an African problem. Because I was in Nigeria, it's the same problem. But it's just beyond even Africa. I was in Asia, I was in Bangladesh. They have the same problem of traditional bone setters. They believe in using bamboo sticks, they believe in using skin or hides.
Why do the person at home feel pain? They say as the person is massaging from their home, this person is feeling a lot of pain.
The pain is because your muscles will continue moving even when you're at rest. There is some movement that you don't see, and there is some micro movement of the fracture site, and that's why the pain will be there. But it doesn't work. Traditional bone setters, if I had my way, they are actually wasting a lot of people's time. Because you know what? What we do now as modern orthopedic surgeons, we fix you today, tomorrow you can go back to the office. But again, the Ugandan culture is that once they are sick, they want to be sick for a long time. We battle every day. We don't even want to have full wards now. You come today, we fix you tomorrow, 2, 3, 4 days. If the swelling is gone, we allow you to go back.
Let me ask, has there been arrangements, and we're still in sidelines, arrangements over the years to sensitize or even train bone setters, or even to probably make them modern orthopedics? I'm just asking, because probably some of them are, okay, we'll come to it, maybe some of them are gifted, they were born to be orthopedics.
Well, I've learned from you that we should train them, but we've never thought about it. We've never thought about training them, but it's something that we can look into. We can actually bring them into the trainings. We train many healthcare workers now. We've just finished one training in Mbale for people who are not orthopedic surgeons on how to treat, because we know we can't treat all the fractures that we have. So it's one thing that we can look into and see if we can get them to train. We show them how to even use the modern plaster of Paris. Instead of them using sticks that could easily injure the patients or tighten, we show them which complications can arise. It's something that we can probably take up as a society, Uganda Orthopedic Society, or even as surgeons out in the far-flung places. We can look at it. But our people believe so much in them, not because they do not want to spend money. They actually spend a lot more even with the traditional bone setters.
Who used to cure and heal broken bones and all bone-related issues before you, the orthopedics,
yes,
like business?
Like I told you, these bones would heal by themselves. Okay? Even us as modern orthopedic surgeons, what we do is just to align them and let them heal in the way God created your anatomy. Anatomy here, I'm talking about your body build, the way the structure was made by God. But we don't heal them. God heals them. We only put them together so that they heal in the correct position.
Continuing with sidelines. So the next one is, under what circumstances do you specialists take the decision to amputate? Because that's a conversation everyone talks about, where you say, now we're cutting that leg off or arm off or whatever.
Now, there are situations where your limb can go, and those ones include what we call a dangerous limb. A dangerous limb, that if we keep it there, it will kill you, take your life. Now, if your leg becomes black and is full of pus, if your leg dies and is the source of infection to the whole body, that becomes dangerous to you.
What do you mean if the leg dies?
Dies. You know, you can get involved in an accident, it's crushed, and you can't even put the bones together. Lots of muscle is mashed, the bone itself is mashed, there is no blood supply to the leg, and in 1, 2, 3 days it has turned black. That is a dangerous limb. Also, if there is cancer in the leg, okay? Sometimes some cancers are just limited to the leg. You can take off that leg. Some of them, like people who have diabetes, if you have gotten a diabetic foot, wounds have started and they are not healing, and they are tracking the muscles and tendons and moving upwards. That's a dangerous limb. It can be amputated. Yeah, but we don't cut every broken bone. We repair them. Even those where blood vessels have been taken, we repair them. And that's why they travel all long distances to come to us.
Because the myth was the moment your bone is broken, separated, then it's cut off.
No, orthopedic surgeons will never cut your leg if it's just broken. They will cut if it's dead. They will cut if it's dangerous to your life. If you develop what we call gas gangrene. You see, we don't get accidents in clean places. We get accidents on the roads which are dirty. We get accidents in our swamps as we graze our animals. We get shot in bushes, in what? Even bullets are not clean. So those need to be cleaned up. And you know, that's why I can go back to the traditional bone setters. If you have an open fracture, meaning if there is a wound, you can die of tetanus from these traditional bone setters. And so that one will ask them, please refer. They should get into our referral system. And that's why I like your idea. We can train them to recognize what can be sent to the healthcare system.
Okay.
Yeah.
And then the last one is, okay, maybe you draw us into the basic first aid tips for any maybe accident victim or fracture, the basic, so that if I'm at home and it happens to my child or my mom or whoever, I can be able to give them that first aid until they arrive to the specialist or, you know, any orthopedic, you know, surgeon, so that it doesn't lead to getting amputated or making the whole situation worse.
Thank you. Yeah. The first thing when you get somebody who has just had an accident or somebody who has had an accident, you need to ascertain, are they alive? If they are alive, are they breathing well? If they are not breathing well, it means there is a problem with the airway. Look into the nose, look into the mouth, probably the tongue has fallen back, look at the neck, maybe it's folded badly. So, but with the neck, be very careful because you could make the injury worse. Yeah. But keep the neck straight on the floor. Don't twist it. Keep the head up, and with the tongue, if it is stuck in there, put something, some sponge, or even your handkerchief between the tongue and the teeth. That will keep the tongue away from falling back to blocking the airway. Now, if the patient is breathing, the airway is patent, meaning it's open, look at the injured part. Is it bleeding? If it's bleeding, you can wrap around whatever material is there, even cloth. That will help, but don't tie it so firm. That can lead to an amputation. That will lead, because the limb can die. You can cut off the blood supply. Just put moderate pressure on that broken part. And if it's one leg which is broken, put them together. Put them together, that's splinting. That will take away the pain. That will remove further injury to the limb. That will help. And even during transportation, please don't just carry somebody with the neck dangling, with the legs dangling. You are worsening the injury.
But if the leg has turned?
Yes,
like
if the leg has turned, the quickest thing you can do, please pull the leg and put them together.
You pull it back to the position
yes,
it's supposed to be?
Pull it quickly, compare with the other one. If both are broken, pull them together to the maximum length and strap them together with cloth. Or if there is an umbrella on the side, you can even use an umbrella to splint it. Because not everybody has two legs.
What if the bone has pierced through the skin?
Pull the leg, or or if it has pierced through the skin and you can't pull because I can see already you're freaking, just put the legs together and find a way. These days we have a good ambulance system.
Okay.
We have a good police system.
Yeah.
Make a phone call to those people so that the patient is transported to the nearest health unit as quickly as possible. And that's what we've been doing. We've been training other doctors to know how to manage people with broken bones when they get to them. They may not have the expertise that we do have, but they will do the immediate first aid, okay, the second first aid now, and refer the patient appropriately to the next unit so that lives are not lost and limbs are not lost.
All right.
Thank you.
That ends Sidelines. You're still watching People and Power. This episode belongs to Dr. John Ekure. He's an orthopedic surgeon and, of course, the director of where we are today, which is Kumi Orthopaedic Center. We're going to take a very short break, and when we return, Doctor, I think we should go check out
Okay.
the center, right?
Okay.
Okay.
You're welcome.